Good morning. Well, today we're talking about Gerald and his case of SIBO. So hopefully you've filled out your form now, your case summary form, and we're just going to go over it together. Just be aware that you're still being given a paired back case, so don't worry if you haven't got all of the symptoms. It is just a good place to get you started. So SIBO is a recurrent condition. And what we do is start you off looking at getting rid of the infection, but there may need to be underlying digestive issues that you may need to follow up with. But let's just have a look at Gerald where he is now and what we know about him. He's suffering from bloating and abdominal cramping. We know that he's better on FODMAPs. I've put infection there because that's primarily what we consider SIBO to be, and he has very smelly wind. So this is often gives you an idea that there could be a methane or a hydrogen sulfide component to the case, so you can take that into account when you're choosing your herbs. But he's got alternating diarrhea and constipation, which may indicate that he's got both hydrogen and methane on board. He has cravings, a large appetite, and stress. Now, the one thing I've left off there is we also know that his immunity is low and he's picking up lots of bugs. So that should really be in there as well. As possible diagnoses, all similar to IBS. So we're going to look at all the same things that we did last week, just with the addition of the SIBO as being likely, or you could put VL down there for very likely. When we're considering what we're going to actually be treating, we've circled digestive system, nervous system, and immune system. The treatment of his immune system is likely to take the form of probiotics and possibly some extra nutrients to build him up. We know that he's been collapsing due to malnutrition. He's had all the tests, so we know that there's nothing else going on. Oh, that's the other thing that didn't get put in here. We should have really put in here that he's been having episodes of collapsing, but that's just likely to be fatigue and malabsorption that's causing that, because he's a very hard worker. No known previously diagnosed conditions, and a naturopathic working diagnosis might look something like 23-year-old A-type male presenting with alternating diarrhea and constipation, indicative of SIBO and low immunity. We don't really know what his motivation is like from this. It could be high, he could be a very motivated person, but equally so, it might be low. So taking a good case so we can hold him to account and find out what he's doing when he comes back in will help us work with him at that point. Current meds, we don't know what he's on, so we can't pop that there, and so that's important information for next time we see him. Other contributing factors. It could be stress, but Gerald is somebody who's had his symptoms since he was a child, so it's more than likely coming from a history of antibiotics or some genetic component. Safety issues, really it's just the collapsing that's causing a problem, so if we've got any repeated attacks, we want to refer Gerald back to his practitioner. If we want to make sure that a diagnosis is correct, we're going to look at a hydrogen breath test, or if you want to look at the bigger picture, you could also look at a CDSA. But I think probably a CDSA would be better later on if you felt like you weren't getting anywhere. Based on our differential diagnosis, you could look at referring him to the doctor to rule out some of these other conditions. And in particular, we want to make sure that he hasn't got celiac disease. I would have asked him at the time at that first consultation, given that he's on the FODMAPs diet, so it may not actually show up on a blood test if he's not been having gluten. So I'd want to just double check, has he had gluten in the past? Some other questions that you might like to ask in that initial point is his weight stable? If Gerald's weight, or if he's losing weight, it could be just a reflection of how severe his malabsorption is, and that's important to follow up on. Once your treatment is underway, if his absorption is getting better, he'll start to put on weight. He's got a large appetite, and it seems to me like he's eating well, so he shouldn't be losing weight if he's not got malabsorption. Also knowing what he's tried in the past so that you're not replicating things that didn't work, or you can build on processes, dietary or supplemental, that have actually worked in the past. You want to know if he's travelled overseas. Is there any infectious agent that needs to be taken into account as well? Or if the stress is actually having an impact on his symptoms, or whether, regardless of whether he's on holiday, his symptoms are still there. Okay. So our treatment aims are slightly different with IBS, although there is going to be some crossover there. Of course, we want to take into account what our patient wants. So we've got alleviate GIT symptoms, and we primarily want to normalize the bowel pattern. We think that underlying SIBO, there is a motility issue. And so we've got to provide support for hydrochloric acid, pancreatic enzymes. So we're going to work closely with dysmotility. Looking at also underlying causes, stress, the immune system, we want some support there. A good dietary plan that's actually going to reduce the triggers or the offending intolerances. And we're going to promote beneficial gut microbiome. So what's our plan going to entail? Well, initially we're going to kill off the pathogenic bacteria that are in the small intestine that shouldn't be there, and improve motility to help drive all the bugs down into the large intestine where they should be. So just looking at what our herbal actions are going to be, we want an antimicrobial, a carminative to help relax the sphincters and reduce flatulence, a bitter, working on stomach acid there via the vagal nerve. Often in SIBO, that vagal stimulus is blunted, so the bitters are going to help to bring that up. And in the case particularly of constipation, we're going to be needing the laxative. You don't have to put that in your herbal formulation though, and often we're going to need stronger acting agents, and magnesium oxide is probably one of the best ones that we have available for that. We're not wanting to rely on it long term, but just while we're getting the treatment underway, you will probably have to use something like that in more severe cases. And then just looking at the long-term effects, we might want to look at adaptogens because our client is fatigued, and just help them to get through. This is just an example of a herbal formula. It is primarily for hydrogen-producing bacteria. So we have pomegranate and berberis. Just be aware, berberis can be quite hard on the stomach. So if you've got any irritation there, you may have to pull back. We've got propolis, which is also an excellent antibacterial for SIBO, and peppermint acting as your carminative. So we've got our 3 antimicrobials, a carminative, and then our bitter to stimulate the vagal nerve there. All fitting into our range, as well as our bottle. So what other herbs would you need to be looking at? Well, we've already identified methanogens. So we could be looking at Atrantil, which is supplied by FX Med, or Alimax. Just be aware that many SIBO patients won't do well if you put the whole garlic in your liquid formula, both from a compliance perspective, but also it could aggravate symptoms. The particular form of garlic in Alimax, or Biomedica do a product as well, it is one that won't aggravate a SIBO patient. So as you're working through your case, the form is set up so that you can look at the portion you've just filled in and refer back and go, tick, does that meet my aims, my therapeutic aims, my naturopathic working diagnosis? You can look back at symptoms and see if they've all been catered for. So just remember that you're always looking back to see that it's all matching. And I've just given you some examples there. So your naturopathic diagnosis, is it catering to that? Your treatment aims, your dietary recommendations and lifestyle, your herbal formula, and your nutritional support. Because you've already identified what you need to be looking at, so you can just use it as a cross-check. We'd probably dispense at least 200 mils, probably not more in case there's any reaction, but we're going to have this patient on for a minimum of 3 weeks, if not 6 weeks, before we're going to be reviewing their gut symptoms. Our client vitality, well, in this case, our client has low vitality, so needs building up, but no particular sensitivity notes except for the FODMAPs. So we're not likely to see any reactions, except do be mindful that the only thing more toxic to a body than a live bacteria is a dead one, because their cell membranes break open. So people can feel initially tired and a bit sort of grotty if they get any die-off reaction. Appropriate dosage there, 7.5 mils twice a day. No contraindications, and we don't really know at this point, and we'd want to if there were any interactions with medications. Okay, lifestyle. Exercise is good, not only for stress, but for motility. So where Gerald is able to keep that exercise going, we want to encourage that, and then abdominal massage as well. We'd choose a FODMAPs possibly, or a biphasic diet. We've given you a couple of diets there to work with, and also avoid snacking. The stomach only pushes using the motility, the MMC, on an empty stomach. So if you're constantly snacking, then we're not encouraging motility to return to normal. So we want to encourage our patient to be eating 3 times a day. In terms of normalizing the microbiome, the partially hydrolyzed guar gum, you'll see from your reading, has been shown to be very SIBO friendly, 5 grams per day, and also specific probiotics. So I've just given you some here that you might like to consider. And then supporting our treatment plan with either B group vitamins or our adrenal support. And I've given you a couple of examples: Adrenergy from Biopractica, Adrenatone from Metagenics. They contain euthania and ginseng, rhodiola, licorice, all to give support for energy. Magnesium citrate is something that a lot of people are low in, and just helps the downward movement of the digestive tract. It can act as a laxative, and of course good for stress and energy production as well. So 400 milligrams is your standard therapeutic dose. People might need more, and some people's gut won't tolerate more, and it will cause diarrhea. So that's just a trial and error with your patients. If you're looking for the specific laxative effects, then you'll choose the magnesium oxide, which I've put there, 1/2 to 1 teaspoon on an empty stomach before bed, and then you change the dose as required. You're probably better to use both types if you're trying to use the stress effects, rather than just relying on the magnesium oxide for that, which is by far the best laxative, but not well absorbed for stress purposes. So just a note on what we're trying to achieve over time. We want to remove specific dietary triggers or stress triggers. We also need to look at establishing that long-term function of the gastrointestinal tract with motility agents. You might like to consider retesting after 2 weeks of your antimicrobials to ascertain whether the bugs have changed in nature, or whether you're improving and you need repeated rounds. And adopting a stress management strategy. Points to follow up. When your patient comes in next time, you're going to need some little cues for things you want to check in with Gerald about. Did he take his herbs? How many supplements are left? That'll give you an idea of the changes that you've seen. Are they down to your treatment plan, or perhaps they're down to the fact that Gerald wasn't following the plan? Did he find it easy? Did he find it hard? That helps you to find a plan that he's going to be compliant with. There's no point giving him instructions that he's just not prepared to follow. So it helps you work together more effectively going forward. Did he have any negative reactions to any of the supplements? People do have individual reactions, and that will help you tweak your plan. And then just finding out what his symptoms have actually been, so you know how successful the plan has been. His abdominal pain, so his major symptoms. What's the bloating like? What's the diarrhea and constipation like? And also checking in with his scores out of 10. So it gives you some idea of of what's happening. And of course, how's he coping with his stress? Well, I hope you enjoyed that second case. If you've got any questions, do fire them through on the forum. Let other people share their experience and learn from your questions, and I'll answer them as they come in. Thanks, and have a good week.